Is there anyone that shouldn't take creatine? Can you show me what 5 grams
Yeah,
looks like?
absolutely. So this would be a standard 5-gram dose.
Which is 1 scoop. So 5 grams is 1 scoop.
1 scoop.
And you're saying we don't necessarily need to do this loading phase that bodybuilders would told
Correct.
to do.
So the loading phase is the most rapid way to saturate your muscles. Now, that's very beneficial, but that would be 4 scoops. So 4 scoops is a loading phase per day, and it's very effective. But the issue is, can it cause some adverse GI tract irritation, things like that? That's where anecdotally people have reported that. But a lot of people from a muscle perspective will start with just 5 grams a day, and that's very beneficial.
And at 5 grams a day, what benefits am I getting?
Across from a skeletal muscle perspective, you get a whole plethora. So you definitely get an increase in lean tissue mass or muscle size. And then again, muscle performance, muscle strength, power, and endurance. And the other one that never gets a lot of press, which should, is functional ability. An older adult to sit to stand. This has applications getting off the toilet, out of the bed, out of a car. So as we get older, we're losing muscle strength and performance, as well as functionality, and creatine and weight training seems to come to the rescue there.
And is there anyone that shouldn't take creatine?
You know, I can't find anybody that can't or shouldn't. The safety profile is exceptional. If they have pre-existing medical conditions, they definitely need to speak to their doctor. Besides that, I'm not seeing any reason a healthy individual can't take or shouldn't take creatine.
And pregnant women?
So that's an interesting, a colleague of mine, Dr. Stacey Ellery out of Australia, is now finally looking at human trials with pregnancy, going into breast milk, into the fetus. So it's still in its infancy. The jury's still out, but as it currently stands, it seems to be relatively safe and well tolerated.